Okay, we'll make a start. Thanks very much for coming. We've just started a little late because it's graduation, so parking's really difficult. So hopefully there's not people outside driving around looking for a car parking space when they want to listen to me and Gemma. So welcome to the seminar. This is co-hosted by the Centre for Public Health and Population Health here at the University of Stirling, but also by the Scottish Collaboration for Public Health Research and Policy. So I'd just like to thank Ruth at this stage for organising the seminar with us. Obviously Ruth is now with the collaboration. So today I'm going to talk about the development of an intervention in a bingo club for which we took a participatory approach. I've got all the co-applicants for the project listed on the slide here. And I'd just like to acknowledge Ruth again and say that probably about 3 years ago now, it was actually Ruth's idea originally to think about going to work in a bingo club as a place for the development of health interventions. I'd also like to obviously acknowledge Gemma. She's been the research fellow who's worked on this project for the last 15 months. And at this point I'm also going to apologise because I'm leaving at 1 o'clock. I'm leaving the presentation in Gemma's hands, but that's really what I did with the project as well. I just left it in Gemma's hands, so it's just part of the course really. So I'll apologise for the fact that I'm leaving right now. And the study was funded by the Chief Scientist Office, so again acknowledge them for the funding for the study. Okay, so begin a bit with the background to how we ended up working in a bingo club. Many public health interventions are very complex, but they operate within systems that are quite often not very well defined, and we don't necessarily understand very much about them. And the components of public health interventions are often quite poorly defined, they're quite poorly developed and theorised. And I think this is because most research time, effort and funding is focused on the evaluation of interventions after they've been delivered, and they're very much focused on assessment of outcomes. And this evaluation and outcomes assessment seems to be much more valued in the research community than development work, when it's really at the development stage that we need to get things right to make sure that public health interventions are fit for purpose. Hopefully this is changing a bit now, and I think with the Public Health Intervention Development Scheme, which is a Rapid Response MRC scheme, which is providing money for developing public health interventions much more at the early stages, maybe this suggests that things are changing a bit, but certainly up until the case right now, as I said, a lot of the effort has been focused on evaluation afterwards. So we were kind of thinking that more resources and thought on intervention development could well increase the acceptability of a public health intervention, could well facilitate the implementation of the intervention, and thus increase the effectiveness. So we were thinking much more in terms of spending more time at the development phase. But why in a bingo club, apart from the fact that it was Ruth's idea? None of us actually played bingo before, but we've played a lot now. It's often economically disadvantaged people who are most in need of health interventions, but quite often they're excluded from the sorts of settings where public health interventions might be delivered. And a good example of that is workplaces. So a lot of socially and economically disadvantaged women would be excluded from workplaces. And it means they have quite low uptake of many of the traditional public health interventions. But we thought bingo clubs would be a setting that got high proportions of the population group that we were interested in, socially disadvantaged people. And obviously we were interested in social disadvantage because obviously with the inequalities in health in Scotland. We also know that public health initiatives are more likely to be successful if they're linked to the everyday life of communities, they're led by community members, and they build upon existing culture, values and beliefs. So thinking of the bingo club, it's a setting that we thought socially disadvantaged women might be familiar with. So we thought, why not go to them and take development of an intervention to them rather than the other way around. But And this is what gave us the idea for taking more of a community-based participatory research design. We took elements of a CBPR approach to develop the intervention with bingo players for bingo players. So we wanted the intended recipients of the intervention, socially disadvantaged women, bingo players, to be much more involved in development of the intervention. This is important because there isn't a natural link necessarily between health and bingo. We couldn't guess what bingo players wanted, but also we wanted to create a bit of sense of ownership of the project for bingo players themselves. And we wanted to think about developing an intervention that was much more based on the culture of people attending bingo, their values, their identity and beliefs. So we thought it was very important to engage with stakeholders and the community at this stage of the intervention. We didn't use a full CBPR approach. A full CBPR approach involves basically just going to a community and getting them to come up with their research needs or research ideas. We'd done that to a certain extent. We knew what we wanted to concentrate on. We wanted obviously to develop a health intervention, but also we were thinking mainly in terms of physical activity and diet because of the obesity problem in Scotland. So we did have some ideas already, which is why we can't really say this is a full CBPR approach, but we used quite a lot of elements of that approach. So these were the aims of the study that we put to the CSO at the time. We want to investigate the feasibility and acceptability of using bingo clubs for the delivery of an evidence-based physical activity and healthy eating intervention to socially disadvantaged women, and we wanted to use participatory methods to ensure that the intervention was sensitised to the context. We didn't know a lot about bingo at the time. We got an introduction to the Stirling Carlton Bingo Club through a research fellow we had working at the time. I don't know if you remember Dion, but her gran played a lot of bingo, and her gran introduced us to the manager of the Stirling Club, so we went along. And the thing I want to stress at this point is that the bingo club, it's serious stuff for the women who play, and it's quite hardcore bingo. It's not just Butlins bingo. It's not just a fun thing that they do occasionally. It's pretty serious. The club's open 7 days a week. Most days of the week it's open for 12 hours. There's lots of sessions all the way through the day. It's fairly costly, £4 a morning, £15 in the evening. And there's also more cost for playing the boards. These are electronic boards which are at the bingo tables that people can play in between the traditional calling bingo. So they can be playing all the time when they're in the club. But the actual call-up bingo games are played in sort of 20 to 30 minute bouts with breaks in between. But importantly for us, it's a big place with lots of people. The capacity for the bingo club is about 1,000, and they have 1,500 to 2,000 people through the doors every week. A high proportion of economically disadvantaged people, but by no means not only social and economic disadvantage, as Gemma's going to go on to show you. But it's pretty serious stuff. It was quite a daunting environment for us when we first went in. This is the club in Stirling, so it's a large place, lots and lots of rows of tables with the electronic games. It's not a particularly pleasant environment. There's no natural light at all, and it is quite daunting when you go in and don't know anything about the bingo sort of culture, because there is a culture associated with it. There is a way to behave that we had to learn. You absolutely cannot talk during the bingo calling sessions, and you get some pretty bad looks if you do that. As I said, it's not particularly conducive. The idea, there's not a natural link between health and bingo. This is what Gemma had for tea one night at bingo. She says that photo was taken in the bingo, not at home, but I'm not sure about that. But that's the bingo club, and that's a little bingo stamper. But there is a culture associated with bingo that we had to learn about, really. So we spent quite a lot of time at the beginning engaging with stakeholders of the community, but also getting a kind of idea about the setting we were going in with. So the researcher, obviously Gemma, undertook the following task, but to a certain extent we all did this a bit. We all went to the bingo. We got to know the club manager. Finlay Meakin was very welcoming to us. He let us into the club and was very helpful, but distanced himself a bit from the project, but certainly let us into the club. We played bingo. We recruited 2 player reps for the research group. This was part of our participatory approach, so he suggested 2 women that we actually invited onto the research group. We held a lot of the team meetings in the bingo club itself, and they came along to most of them. And we also recruited a staff rep, played more bingo. We created an identity for the project. That's our logo down there. And we do all have T-shirts, but we all forgot to wear them today. And Gemma did quite a lot of covert observation and played a lot of bingo, because we were trying to understand the culture of bingo and the kind of mechanisms of its appeal to this group of women that we were interested in. And I'll just say now, because everyone always asks this, whether or not we won any money. We did win a bit of money, but single figures, and certainly not enough to give up the research. Okay, so this was the outline of the project. We did it in 2 phases. Phase 1 was kind of a needs assessment to see what the kind of needs of the population were. We did a focus group with players. We spoke to staff and managers, and we carried out a literature review. When I say we, I mean Gemma, actually. And this was to come up with additional ideas for the intervention and to develop some kind of programme. Phase 2 involved a workshop with players to refine the programme, and we've just put in an application for further funding to do a feasibility study of the intervention that we have developed. So I'm going to pass over to Gemma at this point, and she's going to go through some of the methods and development of the intervention.
I know already that I've got far too many slides and information for the amount of time that I have available, so you have to bear with me if I seem to go through some quite quickly. It is reassuring to know that I actually did do a fair bit of work when you try and put it together in one presentation. So I'm going to start with the first aspect of the methods, which was the focus groups, and for me this was a really key part of the project, and it's really where we kind of started to get people's views. So this is Josie and Aileen at the front of the Carlton Bingo, so already showing that the club were supportive of us. They allowed us for a whole week to set up at the front there with little signs saying, come and talk to us, ask us what we're doing. A lot of people thought, because we had the pink going on, they were actually going to do breast cancer research, like, oh no, we spoke to you last year. So I know this is something different. So they obviously do get a little bit of saturation with this kind of thing. So we spent 1 week at the club. Pretty much every member of the research team came down to help with recruitment. We just had a little flyer to get an expression of interest with the sales pitch that they're going to get £15 if they took part in the focus group. We thought that would be a really good incentive for them to come along just to one out focus group. And then more on the research side of stuff, we did semi-structured focus groups with them. We were aiming to do 4 focus groups of about 4 to 6 people. That actually changed a bit more in reality, but we'll come on to the results later on. They were all held at the club. They were mixed times a day and of days of the week as well. You can already see how many people come at different times of the day. You know, people come in the morning, there's evening bunches, just the people that come on a Saturday, so we had to give them the opportunity to come at many times. We tried to coincide it with when bingo was being played, so either before or after sessions, so people would be like, oh, I'll just come a bit earlier, so it was a bit more attractive for them to come along. And the club reps as well also attended, as well as the research team. Most of the focus groups, we had one at almost every focus group, which was great to show that the club was supporting it. Especially the staff member, she came along to a lot of the focus groups and would pop in, and the manager would sometimes just drop in during the focus groups and things. So it did show people that we were supported by the club. We asked some questions relating to why they played bingo. Now that was actually an icebreaker, but it turned out to be the most valuable thing I think we kind of asked them was why are they here in the first place. Their thoughts on healthy lifestyles, like Josie said, talking about physical activity and dietary behaviours. What physical activity and healthy eating was to them, so we tried to explore that a little bit more. For the purpose of the intervention development, we asked about barriers and facilitators to such healthy lifestyle changes, and what they think could work at the bingo, which I really should put what they think wouldn't work at the bingo, because we got a lot of information on that side of things. Oh yeah, and the focus groups were recorded, transcribed, and then analysed using an informatic framework. Now, we were meant to have an active focus group and interviews with the staff and managers, but because they were so helpful and really keen to take part in the project and give us ideas, we had so many informal discussions with them that we didn't actually end up holding a formal focus group. The other issue was that actually we had set up a formal focus group with them, and because it's not their core business, bingo, the bingo and physical activity and health eating don't necessarily marry particularly well. We ended up not rearranging the focus group. So that we deviated from the plan a little bit there, but still managed to get the information out, because Finley would just come up and say, oh, that won't work, what are the ladies saying, what's going on? So I kept notes as I went along with that, and used that to inform what the staff and the managers were thinking at the club. We also did a needs assessment. So we did not just want to find out what they were thinking, what about the intervention, but we did want to get an idea of how physically active and how healthy they were, so from doing a questionnaire. So we spent another week at the club, and again at the front there in our wonderful bingo t-shirts. The way I kind of sold this was that if you complete the questionnaire, you're going to prize draw to £100. We thought the idea of having a possible prize, which is what bingo is, would be an incentive for them to go in. And I would keep talking about the odds of them winning the 100. So I had a little tally thing here. I was like, we've only got 20 people who've completed it, so your odds of winning the £100 are looking really good. So we were using that as an incentive for them to take part. Within the questionnaire as well, we looked at physical activity. We were going to use the IPAC, and we also used Dine as well, which is for looking at food choices and how much fat people eat, if they use butter and things like that. We trialled it with the focus group participants, and they had real difficulty filling out the IPAC, which is the International Physical Activity Questionnaire. It is the standard one. It's one that sometimes I wish I had used it, but we ended up using the Active Australia instead. And our ladies seem to understand that a little bit more, because I know it's one that's been very heavily tested in women who are kind of 50 plus. But to be honest, I think they had just as much difficulty with that. So a little bit of a understanding about self-report, physical activity questionnaires there. Within that questionnaire, there was also some demographic information and some other health status. So if they had health conditions, or if they were living alone, because we thought that might be something that might be interesting to look at. And this is also Bill here. He was one of the deputy managers. He pulled the prize draw for us as well to make sure it was nice and official. So because of the uncertainty with the self-report measures, we then decided to look at using accelerometers, which are little activity monitors, which can tell us objectively how much physical activity people are doing. So this is something that we didn't actually have in the original grant, but it's something that I've had experience with, and I knew, I have to say thank you to Trish from the School of Sport, who lent us the accelerometer, so there was no extra cost there for us. So we got some ladies from the focus groups who are already taking part. We asked them if they would like to do it. We also, at the back of the questionnaire, had a little tag, a little pull-off saying, if you want to take part in other things, for example, wearing a little gadget, tick this box. So we got about, I think it was about 60, 70 people from the questionnaire, and then we had our focus group ladies as well, who we asked to wear the accelerometers. So there's a little deviation from the plan. We also did a literature review as well to look at what had already been done in this population. We didn't want to reinvent the wheel, and what interventions might work in this population. So we had a two-level approach to this. We looked at the grey literature, specifically within Scotland. So I contacted NHS Health Scotland, all my contacts kind of within Pass for All, and then contacted the research team and asked them who they knew to try and get this kind of formal evaluation things. So we were looking at case studies and all that kind of stuff as well. And then also did a quite traditional academic search of literature as well. So moving on to the results side of things. We handed out at that 1 week recruitment session 450 forms. We got 91 of these forms returned. So this isn't the questionnaire, this is a would you like to take part in the focus groups. We had a few issues. Some people didn't provide any phone numbers, so they were not contactable. When we called them up, 11 people declined, 28 we had no answer after several times of trying, different times a day. And for some people, the time that we were setting up didn't suit. 45 agreed on the phone to take part, but then we had a fair few no-shows at the focus groups, which we were expecting, to be honest. 70 didn't show up, 2 did call to cancel, so those ones didn't actually call to cancel. And then we had a +1 because somebody bought a mate to ask to be involved, which again shows the kind of benefits of word of mouth and the kind of approach that we were taking to it. So obviously we let them come along. So 27 people completed the focus groups. That's 6% of the forms that we handed out, which I think we were quite happy with. It was what we'd said we were going to do. And yeah, I think we were quite satisfied with that number. We ended up doing 6 focus groups because I had to put extra ones on for the people who had cancelled, and we were desperately trying to get a wide range of demographics as well. And I'm showing you on the next slide that we didn't manage to get the younger cohort who had initially expressed an interest but didn't come to the focus groups, or maybe were the non-contactable ones and things like that. So of this kind of younger cohort, and by that I mean 55 and unders, we didn't manage to get that many of them at all, but we managed to get a decent percentage of the higher age group here. So that was an interesting finding, and that was despite the fact that I held a few focus groups at pubs as well, at places what I thought, and at times I spoke to my young mum friends and what would be convenient to them. They're like, well, the kids would go to bed about this time, and then you'd need to speak to them at this time, and if you offer them a glass of wine, then they might come along. So we were trying all these extra incentives, but still, actually, at that focus group, we still managed to get, I think the oldest was 92 in the evening, so maybe the glass of wine was just as appealing to her. But one of the very interesting things, obviously Josie's highlighted this at the beginning, is that this was aimed to target women from areas of low socioeconomic status, according to the Scottish Index of Multiple Deprivation. We managed to get a good percentage of people from 1, 2 and 3, which are our target area. Now I know it says we've got 100% there of this, the area 5, but actually only 2 people completed that form in total, so we managed to get both of them. But of this kind of lower SES areas, we did manage to get a fair few, which was a massive success for us. So looking at the focus group results, okay, we were looking at why they attend the bingo. Like I said, for me this was so insightful, and it's just things that I didn't quite think of myself, and you wouldn't come up with yourself particularly. So the major reason they attend the bingo was for company. This came out outstandingly as the most important thing. It was about social, it was about meeting friends, it's what they did. And then this is in order of the frequency of how much they said these things. So a day out, keeping the brain active, so that kind of side of stuff was really important to them. They're like keeping you sharp and things was really key. Winning came through, enjoyment, me time and time to relax are interesting ones. They came through more in the very few younger people that we managed to get involved in the project. So they go to the bingo more for, it's my time away from the kids. Like this is my zone, you know, it's time to relax and things like that. So already there's some issues coming through about promoting physical activity and healthy eating intervention in this environment, because they see it as something quite different. So looking at some of the quotes to do with that, keeps the wee grey cells going. It keeps you alert, as they say, and plus it's the company. Everybody says hello, everybody knows your name, and very much it's a day out for them. This final quote also highlights the kind of idea of habit that was going on at the club. They go on a Friday, they meet the certain people, they get the certain bus, they come to the bingo. It's very habitual, it's very routine, and they do not like breaking that routine. So even us trying to do a focus group before the bingo meant they had to look for a new bus. And that, you know, had to change all these things, so it was quite a big barrier for them. Looking at the idea of whether we should be looking at physical activity, healthy eating, or both, this was something I struggled with actually, because it was difficult to see what we think would work, and we tried to go in with a blank slate, so they really informed what was going on. But they didn't really state a strong preference for either. They perceived that they already had a healthy diet. Healthy eating was mentioned more readily than physical activity, but probably because we can talk about food maybe more than we do physical activity, because we have to eat. We do eat, so they could talk about that quite readily. However, the interventions they suggested to do with healthy eating were not possible to do in the club. So one thing that came up was change the food in the club. But we were looking for more a group-based, getting that social context in there. And the only other thing we could have done was the education-based things, which they didn't seem so keen on. So we were already getting an idea of what we were going to be doing. Looking at the individual barriers to physical activity, ability, that was the major thing. The fact that their hips were sore. One person's like, oh, I've had 6 knee replacements, like left, right, left, right, left, right, kind of thing. And you're like, gosh, there's a lot of disability in very very young, some of the younger people as well. I hope I don't have these problems when I'm 45, which is what some of these ladies were. There's other priorities, but again, that kind of came through more with people with family, with grandmas looking after grandkids and things like that, and in the younger people who talked about work. A lot of people we spoke to, it was more the disability, which again shows that kind of 55 plus issue more than it being a bingo specific, if that makes sense. And again, set routines, lack of motivation wasn't strong, but it did come through. So we've got quotes along the sides of, I can't walk as far as I used to, I just can't do it. There's a lot of can't, won't, it's very much a barrier for them. I can't walk as fast, I'm restricted. So this was a really interesting insight. And this doesn't come up necessarily, I know this is to do with walking, but a lot of it was to do with, I just find it hard to function. They very rarely said it directly in relation to physical activity, but it still gave us an idea of what barriers could be for physical activity. Bingo related barriers. Now, as Josie said, bingo is for bingo. Okay, there's not something else that they really want to do. They want to come and they want to play bingo. It's about making money. The club is very much about the money side of things. They have to. We were talking initially about doing an intervention between games, or like kind of during games, and somebody was like, well, how do they make their money? They got the cash bingo, which is the slot bingo that you can play. And they said, well, if that's how they make about £350 per 15 minutes during that time. So we were getting a very strong idea of what wasn't going to work in this setting. Because I had an idea of them getting up after bingo, but standing and then sitting down and walking between games and things. This was very quickly becoming a no-go area. And some of them would maybe tell you to bugger off. That was something that came through quite strongly, is people's perception. So again, that what will Joan think of me being at this focus group and what's going on and the environment I'm in. That was really interesting. It came through a lot. Again, what I said about the mini bingo, when will they make the money? When will they have time to exercise? People go for the bingo. They just want to go for the bingo, no strings attached. So these are really important issues for us to consider. So looking at what might encourage them to be physically active, again, they didn't mention anything directly related to physical activity, healthy eating. But what we were looking at is trying to address maybe their concerns to other aspects of their life. So although they didn't answer the question directly, they did tell us that keeping mobile and independence were really important to them. And also, they told us why they played bingo. So if we could try and incorporate these things that they really value into the bingo and into the physical activity intervention, then maybe that's a bit of the buy-in. So instead of saying, what we normally tend to do in health promotion is, physical activity is really good for you. You'll live longer, says me to the 82-year-old who that's maybe not her top priority and who's in a lot of pain. But these other things they do value massively, the social and enjoyment side of stuff. Looking at whether it's feasible and acceptable, we had a shift. There's definitely a disconnect in bingo, like I said. But during the focus group, you'd ask that question, they'd say, no, you couldn't do anything. What could you do? And somebody would start going, well, maybe you could do something. And then they came around to some would, some wouldn't. And then all of a sudden, we had to give it a shot. Or when you're coming in, it's worth a try. You've got to come in. So there was even a shift within the focus groups, and I feel that happened across the project as well. People just came on board a lot more. Looking at what interventions might work, it's very difficult for them to come up with ideas. We went in with a blank slate. Maybe that wasn't the best approach. Maybe I should have had a few more kind of tools that I could say, well, what about this, what about that, so I'd get a bit of a better idea. And again, physical activity and health eating wasn't necessarily on their minds. It's not top of their priorities. They've got other things that they value more. They came up with some ideas of what type of interventions. These are just basically, sometimes said, I go to Zumba, so I put that in. So things that they might be interested in. So we did a little tally to try and get some ideas for what intervention could work. And the same with the what we call attendance strategies. So I was like, well, what would encourage you? What would maybe be important to you? So the idea of getting money off your books, free bingo, was something that might be able to help in this situation. We got invaluable suggestions of what was not going to work. Not early. We could not do this too early in the morning. One of the issues was buses. Second issue was, my blood gets up about 2 hours after me. So the ability side of stuff is a real concern for them. They need to take the time to get moving and to get mobile. So having something at 9 in the morning or 9:30 was just not a goer at all. They didn't want it to be too long, so they liked the idea of short, kind of novel exercise, but the thought of doing 60 minutes or something like that would have just put them off from the start. Had to be manageable. We had to cater for these abilities that they told us they had problems with. And a lot more comes out at the workshop kind of level, but also before bingo. So like we said, we can't interrupt the bingo game. Looking at the needs assessment side of stuff, this was quite interesting. We got 162 questionnaires completed, which we were quite happy with. It gave us a good overview of the basic demographics at the club. So although the initial expression of interest also gave us a bit of that, this shows us that majority of the people, 57% of those who completed the questionnaire, you can infer that means who's at the club, but it wouldn't be directly true. 57% were in Sim D1 and 2, so the target population. So yeah, happy days for us. And the average age was 56 years. It didn't highlight a specific need for anything, at which point I think I felt like crying at me. I was expecting something to come shouting through at me. But physical activity did come through slightly stronger, which I'll show you in a minute. But a lot of them have reported some kind of ill health or disability. Now I looked at the national stats are for that. So 37% reported ill health or disability, and at a national level it's 28%. So that we've got a demographic here who are definitely at need, even though they don't self-report that they have need within physical activity or healthy eating. So that was really interesting. And again, if you look at it specifically for 55 plus, it's a lot higher. So almost 50% have some kind of disability. So we then tagged them with accelerometers, like I showed before. We got 29 people with valid data. Which is basically the capacity. That's as much as we could do within the time capacity. And they, on average, did about 18 minutes of moderate to vigorous physical activity a day. So that is under, it's hard to directly relate accelerometer data to government guidelines because they were measured with self-report. But that is less than what we would be looking at, which is about 30 minutes at least. Having said that, if you split this into those from the focus group and those people who ticked the form, the people who ticked the form were going, oh yeah, I want to buy a gadget. Yeah, I'm quite active. Let's see what I do. And they would walk to university from the bingo to come and get more data on the accelerometer. So they massively skewed the sample. So I wouldn't say they were exactly representative of the population. But the ladies in the 55 plus were definitely. So if you looked at the 55 plus, they were about 13 minutes of physical activity according to the accelerometers. We looked at the grey literature, like I was saying. I'm not going to spend too much time on the review side of stuff, but basically we didn't find any evaluations or anything that could really contribute to what the type of intervention. They were either in younger people or low SES, but there wasn't many in low SES older populations that we could find. Looking at the academic literature, I am going to scan through this very quickly. One of the issues with the review that we did, which was kind of everything was happening at the same time, was a lot of the studies that came through were in young low SES people, and very few were in our population at all. So although we took ideas from them, it was quite hard to directly relate, so there wasn't like a pull off the shelf intervention for us. So looking at the learning, well, we didn't attract those under 55. We know what their barriers and enablers are likely to be, and they're likely to be different for this population. Health eating wasn't feasible at the club, and it was hard to generate ideas from these people from scratch. We had lots of types of intervention and lots of strategies, so we had this funnel effect. I had so much information that I was trying to narrow down. It was very difficult to do. And we had a lot of conflicting information as well. And also I had an issue with kind of finding out whose voice counts. So if one set of information was telling me, like the literature was telling me one thing, but the focus group participants were telling me another, where do you want to put the emphasis on that? How do you make that kind of judgment call? So just going to go to the workshop side of things, which I think was the most crucial part of the project. This showed us so much stuff. We were meant to do a series of extra focus groups after this initial phase, But I was concerned that we were not going to be able to narrow down into an intervention that we could deliver. I was frightened that it was going to open up opportunities again, and then that we wouldn't be able to find it out. So we brought everybody together to gain consensus and to triangulate the results, so we could say, well, we found this from this source, we found this from there. What do you guys think? Did we interpret that correctly? We recruited participants in the focus group. We send them party-style invites out, so it was a bit more, again, of a fun approach, that you're coming to a day out, you're not coming to research. They had a free lunch at a nice smart hotel in town, games, icebreakers and prizes, and gifts and payments for attending. So they got a certificate of participation. We made our own bingo dabbers, and they got a nice little invite as well. So they were invited to a royal kind of garden party style thing, is what I wanted to get across. So like I said, we visually represented the results from the phase 1. And one of the other key things was that we showed them a YouTube video of the activity. So we were like, buy yoga, which you mentioned. This is yoga. What do you think? Does it appeal? And we just got people shouting out comments and things like that. And it was really interesting for them to visualize it and see what they would actually be doing. And then they had different opinions on the types of activity. We then got an indication from that of the type they wanted and what attendance strategies were important. This is us at the workshop day, so that's me telling them about the results we found out in a kind of funnel format, like I discussed, voting on their activity preferences there. That's Ruth using the YouTube. And they also did an activity session, so they did some chair-based activity during the actual session as well. So we ended up getting 19 participants attending, and we got the Well Bingo team came along, Active Stirling came along to lead the activity sessions as well. So 27 people in total attended this. So one of the key things I said about the YouTube videos is that they watched the yoga and went, I can't do that, I can't get up off the floor. I was like, I would never have thought that would have been an issue. That was literally like a light bulb moment to me. And it started, this workshop just started knocking out ideas left, right and centre for us. So we got a big clarification of what they do and don't want. In their preferences, you can see here this chair-based exercise came through astonishingly as the number one thing that they were wanting, along with line dancing. But not dancing so much. They like the line dancing because that's like dancing you do on a Saturday night. It's not exercise, it's just dancing. So we got in a great idea of what was really important to these women. I'm going to skip through this one a little bit more. This was actually a questionnaire we gave them on the day. And what we found from that is that they didn't like to do things outside. So he said, would you like to do your activity inside, outside? And most of them were like, oh no, we don't want to be outside. Like, why would you want to be outside? Which completely sent out my idea that they were going to have lead health walks outside the club, around Kings Park and back in. So that went completely out the window. And looking at attendance strategies, they said that this wasn't a reason why people would come in the first place, but it might keep them going. So the major thing was, if you pay £1 per session, that it'd go into a kitty to take you to another club as a social activity, maybe at the end of a couple of weeks or what have you. So that was the major thing that came out from that, to keep them interested. So we had a whole bunch of learning, which I'll actually show in this format. This was a logic model that I came up with to try and represent all this information, all this data that I've very quickly rushed through and told you about. So this is our input here, the time, the understanding, the focus groups and everything that we did. There was a very big disconnect between bingo and the physical activity, like I said. The barriers, the reasons why they like to attend the bingo, the barriers to having a physical activity intervention, which helped us come up with a set of things which we knew were criteria that we knew we had to put into the intervention. So that brings me on to the final stage, which is, so you should tell me all that information, what on earth is Well Bingo then? So we decided to look at it as 7 core principles. So there's principles that would be applied if you went to do Well Bingo in any kind of bingo club setting, which of course still have to be tested. But a Well Bingo intervention will improve the health and well-being of bingo players. It's developed with bingo players for bingo players. So the community-based approach to them informing it has to be a core component of whichever club you do this in. It's embedded within the culture and the context of the bingo, so it takes on board their views, their attitudes and beliefs. It's evidence-based, so it still has to have some kind of research side there. Has enjoyment and social interaction as the foundation. That's like number 1 for me. That's the most important thing. So that's the reason they're going to come. It's adaptive and evolving, so it doesn't just stay static. If they want to change something, then they should be able to tell you what's working and what's not working. And it values an activity and makes it integral to their identity as being a bingo player. So trying to change their habit and bring this into part of what they do. Oh yeah, I attend bingo, I go to the Well Bingo class. So for the Well Bingo in Stirling, we looked at 5 key intervention components which we think would be applicable to other bingo settings. There's going to be a structured group-based activity session. It's going to be very short, I think about 20 minutes we're looking at for the Stirling club. It might be the case if we go into another club that they might want that to be healthy eating, or we might get a younger demographic, so this might change, but you can see how the 7 core components would still be integral to any Well Bingo intervention. We're going to have intervention messages to get that kind of sit less, move more, which we think is still important to build knowledge and understanding at the same time as taking part in an activity. Social component, they're going to have a cup of tea and a chat with the instructor at the end, and we'll be involved in that. The bingo related attendance strategies, which I talked about, and then training of the program leaders. So I believe that anybody who has to lead the Well Bingo intervention should know about what we've done to get there, that it's not just an off-the-wall kind of intervention that we've just come up with, that they need to know the logic behind it, they need to know that it's incorporating the culture and the beliefs of the women involved. So like I said, Well Bingo at Stirling is going to look a bit like this. Chair-based dancing, 20-30 minutes, 3 times a week, 10 a.m. before the bingo starts. It's going to have the light touch messages around sit less, move more. So it's not an education-based session, but it is going to be something along the lines of the instructor kind of saying, oh, so can you think about how much you kind of sit outside of the bingo? So it's a bit more like an informal kind of chat, and then they would be able to feedback each week and go, oh, how did you go with, did you do anything outside the bingo? Like outside the Well Bingo project. So trying to get them to think about not just when they're at the session, but outside that session as well. And like I said, really important, a cup and a chat with the instructor at each session. We still need to test which incentive option they like the most. We think the kitty and the going to the social club kind of concept is going to be important, but we still need to clarify that a little bit more. And we need to develop and pilot the course that we're going to deliver to the instructors. So moving on to the conclusions. We managed to engage a very hard to reach population, which we were incredibly happy with, from low SES areas, and we managed to have discussions with them around healthy eating and physical activity. We know a physical activity intervention in this setting appears to be feasible and acceptable to the club members and staff, and we have developed an intervention with bingo players, for bingo players, which is now ready for pilot. Would this have been what we delivered if we hadn't done this process? Absolutely not. I think, especially more for what I thought, it's completely different to the walking intervention that I had already kind of lined up. Future developments, can we actually do this? We still need to know if this can come to fruition, if we can deliver it, and we still need to do that stage of things. Will using community-based participatory research result in the higher recruitment? So by doing this process, will it make the project more acceptable? People are more likely to use it. How will the intervention we deliver in Stirling maybe differ if we went to Dundee, for example, and delivered it? Like, would the 7 core components be the same, but that like I said, they might want it to be healthy eating based, not physical activity? Can we get other clubs involved, full stop? Was it the time I spent with Finley that has made this successful? We need to test out these kind of things. How important is the time that we spent at Stirling in relationships with one there? So sorry about the quick rush through of that, there's so much to talk about, but if you have any questions, I will answer them. Yes?
Hi Gemma, I really enjoyed that, thank you. It was more a comment actually, because you know you did your accelerometer,
Yeah.
and you found sort of like very low activity levels, like 13 minutes of activity.
Of moderate to vigorous, yeah.
So even taking part in one chair-based exercise session is going to more than double their physical activity for the week.
What they're doing. Yeah, well, you see that we had a bit of a discussion within the group about frequency of that. So we were putting on 3 times a week, but they might only attend 1 as well. So it's difficult to know what kind of effect that will have. But that's why we were keen on getting some messages in there, so that hopefully that effect will will diffuse through other aspects of their lives as well. So yeah, you're getting them in that session and you're getting them, oh, I can achieve this, oh, I can do this, this is good. And I get that on that day of the week, but then I do things outside. So we're hoping that it's going to do a lot more to that.
It maybe doesn't sound like a lot, but actually when you look at what they're actually doing,
yeah,
it's a huge increase for them, isn't it?
Yeah, but there was very active people at the club. Like I said, there was the ones who were, if you split it by focus group and who filled out the form to take part, or if you split it by 50 plus, 55 and over or 55 and under, it was very similar. Is that the younger people were in that I just want to wear the gadget group, and they did a lot more. Like some of the accelerometers came back I would be proud of, and they literally were walking, like I said, from Stirling to the campus to give me the accelerometer back. And you're like, oh, that's great, but we're going to keep things normal. And I think they massively skewed that, and that's why I'm looking at our 55 plus who were genuinely very inactive. Sedentary time was an interesting one as well. It was quite normal for that population too. I thought it'd be exceptionally high, but it wasn't. They tend to potter, so light activity was all right. But yeah, it's the moderate to vigorous, which wasn't so good.
I suppose also a lot of them, they didn't have cars, so they're naturally walking a little bit more than maybe the general population that maybe have more cars. Because most of them were talking about coming on the bus and stuff.
Yeah, a lot of them do come on the bus, and then obviously you've got that natural walk to the bus stop, walk from the bus stop to the bingo. The other thing that we kind of discussed, I think, at team meetings and things is bingo itself enough of an intervention to make people physically active? Because there's an incentive to go out, and if they do get the bus, then look at the activity they're getting compared to staying in home watching Jeremy Kyle all day or watching TV. So they're getting a lot more activity merely by attending the bingo. So that's something I'm really actually interested in for future research.
I have a friend in Canada whose mum attends bingo, and he sees it as a dependency and a problem. Right? And certainly in the US and Canada and North America, it's considered to be a public health problem, gambling, and to a different degree than it's kind of seen to be here. So I just sort of wondered whether there was anything around that flagged in your ethics, or whether, because a lot of the things also would be why lots of people would do any activity, like you could almost put youth groups up against some of your components as well. Like I imagine some of that could be quite generic. So I suppose if this was in North America, would there be concerns, I wonder, amongst the public health community that you're encouraging in a way, particularly in your last comments? I mean, I don't think so, but it's quite a Scottish intervention. So when the brief interventions work that we've done with Ruth is around young people attending doing soccer and doing brief interventions, alcohol, it's a naturally occurring opportunity. But I just wondered if in the literature as well that you found anything that might have flagged this as being, well, yeah, you prioritise one public health intervention, but are you, especially with your incentivising, which you're talking about in terms of research ethics there as well, which I know is common, incentivising tobacco and pregnant women, but I just wonder if you've got any in your literature, or this work has made you question any of those kinds of issues.
Yes, I think gambling is something that we were aware of from the start, and we were trying to stay back from that as much as possible. I think the one few points to mention is that bingo is different to horse gambling on horses and bookies and things like that, or the other types of gambling, and it's actually been shown in the literature that bingo is less of an issue because it tends to be men who are the problem gamblers more than women. So when people don't even see the bingo as being gambling, they see it as betting, but the female, they literally come once a week, they can't afford to come anymore. And yes, even within that you can have a problem, a few people who are going to be at higher risk to gambling, but the mainstay people who come to the bingo are not a problem. They come for their one session and they have their limit, and they buy the books and they go home. But the benefit as well they gain from coming to the bingo, I suppose it's looking at negative consequences of things, is that what would you rather that they have? They come to the bingo and they spend £5, and yes, they're gambling, but they have reduced their social isolation. Maybe the loneliness. They've got more activity coming to the club. They're having a good feed, whether it's good or not, but they're getting all these other kind of benefits, so it's quite hard to kind of split that. So I would say that it's different to other types of gambling, and it's been shown to be different and have less kind of risks with it. But that is still something that we're aware of, and we were keen not to get into that kind of territory too much, because we're not promoting gambling. We're promoting physical activity within people who are already taking part in that. So we're not encouraging people to start playing bingo. We're encouraging them who are playing bingo to do something more about their health.
Just an observation on that. I think you said at the beginning that there were 1,000. The capacity of the bingo was 1,000.
About 1,000. Yeah.
And that in a week you would get 1,200 to 1,500.
Yeah.
I just wonder if there hasn't been a significant drop off then in terms of the number of people who play bingo. And when you say it's not a problem, it's more of a problem for men gambling. If you just look at the TV adverts that come on, an awful lot of them are focusing on women playing bingo at home, which picks up your point about isolation there. So you may have a hardcore group who are getting all of these positive benefits. But I did have a question. You were going very rapidly.
Sorry.
And I didn't quite catch the bit about the healthy eating in two respects. Firstly, you said it wasn't a possibility in Stirling. Is that because the management had the food and there was no way they were going to discuss any changes in it, even if the women themselves said, well, we'd like a different diet?
That was one of the issues, is that the women, you say, what could we do with club, what could we do with bingo? So they think of club food, the food that you deliver at the club. They wouldn't necessarily think of, you could get Jamie Oliver to come in and give us a little activity, a little session on this. But it was very difficult for us to change the food at the club. We decided that was out with the scope of the Well Bingo project at this stage. Would that make a difference? Well, a lot of women don't eat there. Like, a lot of women have to cook for their husbands, so they eat before they come down and things like that. So the kind of the reach of that kind of intervention as well would have been maybe quite limited. So we couldn't do a lot about it. It wouldn't have targeted everybody who comes along. But the other, what was the main point? We were looking at using the bingo context, and even in our application, our original application was, we want to take advantage of the social, it's group-based activity. There's very few healthy eating opportunities that we had that we could do which were group-based. So although the changing the food might have made a difference, it wouldn't have tagged on to the social components that we were really keen on incorporating. So it's actually a logistical thing as well as the group-based stuff.
So in that context then, when you were talking about future interventions, I think you put up that there could be healthy eating ones, there could be physical activity. Well, unless the Stirling Centre is very unrepresentative, I would have thought the same problems would apply elsewhere. So isn't it better just to focus on the physical activity?
I think we were trying not to assume anything, and that's what we've done throughout the whole project. Because it could be the case that, like I said, I've spoken to a few people like, our demographic's a lot younger, or that was people of my age I was speaking to, so they might just see that more. But they were like, but if it was an evening thing and you happen to get that population, they might want to do group cooking classes, which would be quite difficult. But we don't want to exclude that on the basis that we think that it's easier to do physical activity. So we're open to suggestions, but I tend to agree that it probably is more likely to still be a physical activity intervention in other clubs.
I mean, I suppose there's another possibility. I think it could be healthy, it could be physical activity, but there might be other issues to do with health that we haven't thought of. And I suppose our principles allow for anything really, rather than being too prescriptive. And I think that we were very clear that our core components had to be something that could be modified by a bingo club rather than it having to be physical activity. And then people say, we don't want that, we want to decide it ourselves. And they'll probably come to the same conclusions. But it's about giving them that choice to come there rather than us forcing something on them. And also, the other thing is about they want fun and they like music. And I'm not sure, and I think physical activity is easy to do, like dancing is something that's fun and it's to music. So it'd be harder to make a healthy eating project sound fun. So you've still got the health message in there.
We were trying to keep away completely from the health message of physical activity, which is for everybody it's a complete turn off. The potential of future years lived and something that's such a long-term goal. We were trying to get that instant buzz you get from when you sit down, watch TV and have a chocolate bar, that instant, this is good. We want to bring that into physical activity because we're selling the messages and just not right in public health among physical activity. So we're trying to do a little bit more of that as well.
Health by stealth.
Health by stealth, that's exactly what we're looking at. So, any other questions?
Who would deliver the activity in the clubs?
That's a very good question. We had Active Stirling. I said they came along to the workshop that we did, and they were a key partner kind of throughout. But one of the issues is when walking got taken out of the game plan a bit, that they're very much their well-being stuff is to do with walking and walking strategy. So they were less strategically interested in bingo, and for good reason. They don't get money to, they get money for certain aspects. So they were quite honest about it, but they were happy to still provide contacts and things for instructors. And also, my former life was as a fitness instructor, so we probably would use our networks to try and get people who we know who do freelance stuff and get them trained up. And that's why I was keen to get somebody trained up, because I know what fitness instructors are like. Also, a discussion we've had, which we didn't actually manage to get to the bottom of in this phase, was who would that instructor be as far as type. So there is some studies that have done. There was one in the Netherlands with Indian populations who have moved to the Netherlands, and it was a male population, and they had peer-led classes and peer-led education. So somebody of a similar age taking it. But I was like, well, would these women actually want, what did we talk about, a lycra-clad young man coming in? Would that, yeah, would that be more appealing to them, or would somebody that they could respect? So we actually haven't gotten to the bottom of that.
Just as a
Andrew's volunteered.
I've just started going to these classes close to where I went, because it's close to where I live, but it's called realistic Pilates or something. But I do these things, but what's interesting about it is the instructors are all older women that are maybe a bit overweight, and their whole sort of ethics is you're doing it for people, by the people. So it's quite a peer-led thing, and actually the population that goes, they're all quite overweight women and quite unfit, and I think the premise is they feel more comfortable doing these things with the people that are like them. So I just find it quite interesting that that's sort of, they're really, really well attended as well.
Yeah.
And I don't think we have got to the bottom of who it is, but we also think that it's key to the deliveries to get the right person.
Yeah, get the right person.
We're not quite sure, but it could be the bingo players help us decide, and they're on the panel.
Because that kind of links in with likes of slimming relatively small clubs where people have to be through it themselves, and that kind of empathy in the sense amongst participants that the persons has been there themselves. I think that appeals, and they're successful for that reason.
Yeah. I mean, I think my preference would be that they chose the person somehow, or had some say in who they wanted. Because it's not going to work. They're not going to come along if they don't want to talk to the person.
That could be like a linchpin thing, Actually, is it because they got on well with me and the team, who are very approachable, and they, and their safety with knowing me, and how much did that affect, them going, yeah, I'll do that, yeah, I'll wear this, Gemma's coming along, there's an element of that, and you need to make sure that we incorporate that into the intervention side of stuff as well. So that's something I think we're very aware of, but we still need to test out a bit. Any other questions? No? Well, I'll finish it there, so thank you very much for coming along.
Thanks.